Good morning, everyone. We're just waiting for everyone to join in, and we'll get started in about a minute or two. Hope everyone's having a fantastic week so far. And we're officially live on YouTube without any technical errors. So today is a first of many. First day where the lecture notes were available 2 days earlier and no technical difficulties on the YouTube feed. So today's a good day. We're starting off really well. I have a good feeling about this one. And just remember, you guys are always welcome to use the microphone function too. Just keep in mind, everything said can and will be used against you in the court of the YouTube Live. Okay, I think we'll get started now. And we got a couple guys that are running a little late. But again, there's always a YouTube Live feed. That's the great thing about that. So let's get started, folks. So today we're going to speak more about the fundamental networks, the 3 fundamental networks of the human body. We're going to get into the depressed posture. So last week we spent a bit of time talking about the computer / desk worker posture. Today we're going to get a little more into the depressed posture. It's pretty similar, but there are some inherent differences. So we're going to dive into what those are. And then we're going to talk about corrective exercise techniques to help address some of the faulty posture patterns seen in these individuals. So we're going to talk a bit about thoracic rotation as well as deep breathing techniques. And we're going to get into details because I find the more detailed you get into these techniques, the more you can kind of get out of them as well. So that is the plan for today. That's the master plan. Cool. So when I say the 3 fundamental networks, we have 3 networks that help the body communicate to the rest of the body, right? So we have the neural network, which is seen on the left, comprised of neurons, your brain, and your spinal cord, comprising the central nervous system, as well as the peripheral nerves, comprising your peripheral nervous system. So that's the first fundamental network. The second one is the circulatory network. We know that begins from the heart, and that's all the blood flow that goes to and from the heart. So beginning at the heart, we have blood that gets oxygenated by the lungs, goes back to the heart, gets pumped out through the aorta to feed the rest of the body, including the organs, the muscles, all the tendons and tissues. And then the venous system returns the blood, the deoxygenated blood back to the heart to return the cycle. And then we have the fascial network, and this is the one that doesn't get talked about as much. And I know there had been questions about whether we're going to cover myofascia. Well, this is the answer. We're going to get kind of into it a little bit more today. But we also have a fascial network that connects the entire human body. Now, the great thing about these networks is that they're so pervasive, they're so ubiquitous that if you were to just leave that network and take all the remaining parts of the human body out, you're just looking at a view of the network, you can still kind of see the outline of the human body because these networks are pretty much fill the entire human body, right? So let's begin with the neural network first. So in terms of the neural network, we're talking about neurons right now. And this is the part that kind of conveys information, usually in a binary form, right? So either on and off through things called action potentials. We talked a little bit about action potentials and how the nerves work and how they communicate signals. I think in future lectures, we're probably going to go back into how they work, but we're going to explain more about how those action potentials work in the future. But fundamentally, the nerves carry information in the form of a charge within the nerve, within the axons of the nerve, so electrical charge, as well as an exchange of chemicals between the nerves. So at the synaptic clefts, if you guys remember from last year. So that's how the neural network works, and it communicates all that information throughout the human body, from the brain all the way to your fingertips. The circulatory network carries predominantly chemical information around the body in the form of a fluid medium. We know that as blood. Blood's comprised of the plasma and the red and white blood cells. The oxygenated blood originates from the heart, travels to a target muscle, especially ones that are increasing in metabolic demand. And that is where the oxygen is released by the red blood cell. So that's the circulatory network. And then we have the fascial network. And over here, you have a diagram of a collagen fibril. And you'll notice that they kind of all have a tubular-like structure to them. And biology just likes to connect things using tubes. So that's kind of fundamentally maintained within the three types of networks. We've already spoken about how all the demands of the human body can change the properties of these type of connective tissues through remodeling and its plasticity in over a long stretch of time, right? So we talked about how a demand exerted on our connective tissue will affect it through remodeling. We talked about in the very first lecture about bones and Wolff's law, where if you increase the demand on the bone, you're going to have a downregulation of osteoclast activity, and the osteoblast will still be working hard to formulate the bone. So we talk about how that happens at the bone level, and we also talk about how it happens at the fascial level as well. But this fascial network also conveys information in the form of mechanical information within split seconds, right? And this is done through an interplay between a tensile force, so a stretch, and compression, right? And these kind of signals are communicated within seconds, right? So the best example I can give is if you pull your arm one way, it will yank your hip on the other side, right? And that's because the fascial networks are so pervasively connected to one another, right? I guess a more real life example is if you were to tug a blanket that's on a bed from one corner, you're going to deform the entire blanket, right? So think of the fascial network like that. It's what connects us mechanically from head to toe. And it's why I tell a lot of people that have plantar fasciitis, which is the bottom of the foot, or let's say cervicogenic headaches, which usually occurs at your suboccipitals at the top of the neck, that they can actually have a relationship to each other. And that's because of how interconnected the body is through our fascial network. Okay. And my hope is that through the later lectures, we're going to talk about these fundamental networks in a little more detail. We have what we call anatomical planes and anatomical lines that kind of connect each other. So we have the superficial front line, superficial back line. We have the lateral lines. We have spiral lines. We're going to get into all those networks in a little more detail in later lectures. Cool. So let's dive into how the networks actually work together. And what we have over here is what we call a neurovascular bundle, okay? And so this is pretty much comprised of an artery, a vein, and a nerve fiber, all encased in a fascial wrapping. So you have all the three fundamental networks kind of working together. And these neurovascular bundles are found throughout the body. They all run in parallel with each other until they reach their destination at a target point. And at that point, they turn into more of a mesh network, and that's what you kind of see on the diagram on the left over here. So on the left, we have that neurovascular bundle. You have the vein, the artery, the nerve, all encased with that myofascial wrapping. Oops. And then on the right, when it gets to its target destination, it turns into more like this. Okay. And at the target location, you're also going to see things that are colored a bit more purple, and those are the capillaries, which is where all the nutrients, the minerals, and the oxygen leak out of the blood vessels into the surrounding tissue, right? And so you can kind of see how these networks are very highly intertwined and work with each other as well. They're not so much separate as they are together. So to understand the relationship a bit more, each part of the communication network, so if we go back to here, each one of them serves its own purpose in the neurovascular bundle over here, right? So the fascial network, the one that's covering it all and putting it all together, gives the support and the structure to the neurovascular bundle, allowing it to run parallel to each other as well as to disperse to where it needs to, right? We see it kind of more organized over here as a parallel tube. But if you look at the meshwork over here, you're also going to have fascial fibers that give structures to this mesh network. So at the target tissue, you still have support by the fascia, right? And the circulatory network nourishes all the target locations. So it's bringing oxygenated blood to them with the arterial system, the red, while removing all the deoxygenated blood. So the blood that has been used and has to return back to the blood, seen in blue. And we talked about the capillaries in purple. And then we have the neural system. And this is the one that signals and codes to the circulatory system, particularly at the capillary level or capillary, depending on if you live in the States, in order to kind of influence how leaky they are, and hence how much nutrients and how much oxygen is dispersed at a target location. So it's not just random, guys. These vessels, these venules and arterioles and the capillaries over here, they're all kind of controlled by the nerves that surround them, right? And this is important because if it was random, we wouldn't be able to send more blood to muscles that are working harder and that need more oxygen, right? Any questions so far, guys? Or has this been pretty straightforward? I got to do a better job of asking you guys questions. I feel like this semester I haven't been asking you guys as many questions, so I'm going to try to think of questions on the go too. Yeah, I'll keep that in mind. Okay. So what we have here, guys, is a diagram. So we have kind of a big triangle displaying how these networks not only kind of support each other, but I kind of communicate between each other too. So we know that they kind of work together, but they also communicate to each other. And in this diagram over here, we have an equilateral triangle. Each and every corner has its own set network, and the arrows at the edges indicate how each of them are communicating to each other. Okay, so beginning at the top, we have the neural network, and then we have the circulatory network, and then we have the fibrous network. So starting with the neural net, molecules such as hormones and neurotransmitters are sent to the circulatory network. And this is to inform the circulatory network what the brain is planning to do, basically, right? Conversely, motor nerves send motor signals to the fibrous net containing all the muscles to change the tone of the muscles, right? So all the control of the muscles happen through the motor cortex of the brain through the neural net. So that's how the neural net kind of communicates to the fibrous net. Okay, and this puts obviously a stress on the fibrous net. So if the muscles are contracting, it's putting kind of like a stretch on all the fascial networks that surround the muscles. Okay, now in terms of the circulatory network, this also sends hormones and neuropeptides back to your neural network to update the brain about how the circulation is going, right? So, for example, if there's a change of flow due to things like a blockage or a temporary change because the body is going through inflammation, as well as if there's an increased oxygen demand, let's say if you're working out, right? So there's kind of this feedback system where the circulatory network gives the brain an idea through neuropeptides and other type hormones, okay? Conversely, the circulatory network will also feed the fibrous network necessary proteins to feed itself, right? So we talked about how the myofascia likes to remodel itself based on the pressure exerted on it. It does need proteins to do it as well as collagen. So a lot of that is sent to it through the cardiovascular, the circulatory network. And it also kind of influences the fibrous network based on its flow. So we know that the circulatory network is a bunch of tubes that connect the heart to the target tissue and back. But these tubes are supported by the fibrous network as well. It's supported by myofascia. So increased pressure through these tubes can put pressure on the fibrous network as well. And then finally, we have how the fibrous network communicates to the neural network as well as to the circulatory network. So the fibrous network contains what's known as mechanoreceptors, and these are receptors that are found throughout the fibrous network that receive feedback from the stress that's placed on our myofascia. So these type of signals can be things like a load, a stretch, a pressure, vibrations, shear forces. These are all communicated to our myofascia as sensations and sent back to the brain for interpretation, which is this arrow over here, right? And in terms of flow patterns, the fibrous network also kind of guides the flow of fluids, and we talked about why. Because it surrounds the tubes of the circulatory network, it provides that structure to those tubes. Cool. Alrighty. So let's get into the real life example of how all these networks kind of influence posture. And we have the depressed individual over here. So I'm just going to take a quick sip of coffee. So if you look at this posture over here, it's very, very similar to the depressed posture, right? You got kind of like that kyphotic upper back over here. So your upper back's curling forward. You got the compression at the chest. Neck is, well, this individual over here, they're heading in their neck downwards, which is putting increased stress on their extensors over here and causing their subocipit muscles to fire up pretty nicely. So very similar, right? But the trigger for this posture, so the thing that actually led to it, is different, right? With the desk posture, it's just being in a seated, prolonged position for a very, very long time, okay? Whereas the depressed posture starts as a perception in the brain, right? And it usually has something to do with guilt, anxiety, pain, or regret. Okay. Now, this perception is expressed from the neural system to the muscles as a recurrent pattern of contraction, specifically of the muscles in the neck, chest, and back, right? So it's almost subconsciously, right? Like we're not consciously trying to do this, but subconsciously through the perception, the muscles just tend to get tight over time when it's prolonged, right? Now, sooner or later, this will also affect the lower extremities right now. But for now, we're going to be talking about more about the upper extremities and how it affects that. Now, over time, when these muscles are contracted for too long, you get what is known as a chronic tightening of fascia, right? So again, going back to connective tissue remodeling and how increased demand and stress can cause the connective tissue to get really accustomed to certain postures and get tightened postures. This is what will happen over time. And in turn, this affects the whole entire body, right? Now, posture-wise, you can see we have that sunken chest. We have that kyphotic upper back. As a result, there's that increased pressure exerted on the ribs, specifically anteriorly on the front of the ribs, right? You're getting a lot of shortening where the sternum is. Because of that shortening of the sternum, now you're going to get a decrease in your rib excursion, right? So when you take a deep breath in, the front of your ribs actually has to move and expand more than the back of your ribs, right? So that's what rib excursion is. Now, when you have chronic tightening in this posture over here, guys, you're not going to get as much of that rib excursion going up when you take that deep inhalation. Okay? That's all resulting of that chronic tightening of the fascia, which is caused by that contraction, which was initially started with that perception in the mind. Okay. Now, because of that, we're going to have a decrease in breathing that kind of occurs, right? Because when you can't, expand your rib anymore, you can't take in as much oxygen. So your tidal volume, the amount of breathing that occurs subconsciously, just your regular breathing without thinking, decreases, right? So you're not taking as much oxygen. Also, your ability to take a deep breath, so your conscious control of breathing decreases, right? Because there's a lot of that stiffness that prevents it. So this decreased breathing alters the fluid chemistry, right? It alters the chemistry of your blood. There's two things that happen primarily, right? We got an increase of cortisol, which is a stress hormone that's released, especially in the depressed individual. And we have a decrease in oxygen, right? We're not taking as much oxygen because of all these things that kind of compounded up until this point. Okay. So now you can imagine how this turns into a negative feedback loop, right? So we had the perception leading to contraction, leading to chronic tightening, which decreased your rib excursion, thus leading to decreased breathing, which altered your fluid chemistry. And now this kind of feeds back into here because now you're not breathing as much. This is going to affect your perception, and it's going to lead to this negative feedback loop. Okay. Any questions so far? Alrighty. So now, treating depression and why it's so difficult in many cases, it's not just a matter of taking antidepressant drugs like SSRIs or going through a behavioral type therapy to help improve a sense of worth, right? These modes of treatment attempt to fix what we talked about earlier, the circulatory network, as well as the neural network, right? But none of these treatments tend to influence the fibrous network of the human body, right? So the chronic tightening of the fascia, the decreased rib exertion, right? Treating something like this, the best type of treatment must include all three. And it's something that hasn't been touched upon as much that I think garners more attention and requires more attention. So let's dive into that real quick and how we can address that a bit more effectively. And by the way, guys, I'm by no means am I a depression expert. Like my education about treatment of depression and just the type of depressions that exist. are more so from my undergraduate learning about drugs in the brain, abnormal psychology, this and that, but I never went into obviously a professional program. I'm a physiotherapist by profession, so this is by no means to be expert advice about depression, but it's an interesting take about how we can also address myofascia as a way to help supplement the care of the depressed or the anxious individual, right? So, again, this is just a way to kind of influence the way of thinking and kind of add a new technique and think about how that may help supplement what is already being done pharmacologically as well as through behavioral therapy, right? So, let's take a look at how this specific individual who is depressed can be hypothetically treated when we add a level of addressing the fibrous network on top of what was already addressed, which is the circulatory network and the neural network, right? So, at the level of perception, we talk about how guilt, anxiety, pain, and regret that's constantly, ruminated over time leads to faulty perception patterns. And that's addressed with treatments like cognitive, cognitive behavioral therapy, or CBT for short, which addresses the individual's mindset, as well as pharmacological interventions, like we talked about the antidepressants to help kind of calm down specific parts of the brain that are overexcited. So that's at that level, right? But at the level of contraction of the muscles and the chronic tightening, those type of interventions don't quite work there. And so we have to start thinking a little bit different, right? So I guess my question to you is, based on the posture seen on the bottom right, what kind of muscles do you think are getting short, and what kind of muscles do you guys think are getting long? So let's start with the short muscles. What kind of muscles do you think are getting short right now in this posture? If you take a look at the posture at the bottom right, what's getting short right now, guys? Hip flexors is correct. You absolutely got it. That's more like down the line, but eventually the hip flexors will get correct. Will get tight. Yep, yep, yep. So we are getting a tightness of the pecs, both pec major and pec minor, right? We know that the pecs, when they contract, they're going to bring that humerus closer to your sternum, right? And then we know that the pec minor is going to cause that anterior tipping of your scapula when it gets really tight. So that's going to get tight. Yeah, you got it, guys. So your sternocleidomastoid and your scalenes are also going to get tight with this posture, right? So these ones over here are going to get super tight with your chin poking forward. You guys are awesome. That's awesome. Okay. So yeah, those are kind of all the muscles that are getting tight. Now, what are the muscles that are getting long? What are the muscles that are getting put on like a chronic stretch right now? What do you guys think? And we often don't talk about them much, but they do need a little bit of attention as well. So what muscles are getting long? Yep, yep. Rhomboids is absolutely correct. So we know that the rhomboids, when they're short, they retract the scapulas, but in that depressed posture, they're getting more protracted, and so they're getting lengthened, right? Upper traps, I would maybe argue they get a little bit more shortened, right? So we get you know, the hiking of the shoulders. I mean, sometimes they can be depressed, but it's hard, right? It's hard to look at the diagram and say they're actually hiking up right now because it doesn't look like they're hiking up much. But um, I find that in most individuals with poor posture or with really depressed posture, they're going to get that shoulder to come a little bit closer to their neck, so the upper traps might get a little more shortened. But I can see why in that diagram you might think they're getting a little bit lengthened. The cervical spine erectors, at some points they'll get longer, at some points they'll get shorter, right? So the cervical spine, especially the lower one, the lower erectors of the cervical spine will get a little bit longer. The upper cervical spine erectors are going to get shorter, right? So it's a bit of both, but you're absolutely right. Yeah, good stuff, guys. Okay. So the treatment's going to be very similar for the contraction of the muscles and the chronic tightening of the fascia, right? We got to lengthen the muscles that got short, and we got to shorten the muscles that got long, right? So for the pecs, we got to make sure that we're lengthening them a bit more, as well as the pec minor. And then for the rhomboids, we got to shorten them. So we got to start giving more signals of shortening, right? So that's at the muscle level. At the fascia level, we're eventually going to talk about how we can include the whole body to kind of open things up like your depressed posture, but definitely got to address those two things. Okay, so let's talk about the decreased rib excursion now. So we know that changing the muscles that will influence the ribs, like your rhomboids, pecs, will help things open up. But we also got to look at the joint level too. So at the joint level, we got to look at things like thoracic extension. We got to look at thoracic rotation. We got to look at things like just normal rib exertion through breathing, right? So we got to open things up at the level of the joints as well. We do that through our thoracic mobility work, right? So we're going to talk about these two techniques in a bit as well. Lastly, we got to look at how we can, fix our fluid chemistry, right? So we talked about with the depressed posture, eventually it leads to decreased breathing, which will increase your cortisol and decrease your oxygen. So we gotta, use deep breathing. So actively taking in oxygen and forcing yourself to take deep inhalations as well as slow exhalations. This will help improve a few things, right? It's going to increase your oxygen consumption, but it will also affect cortisol, right? Cortisol, we know, is a stress hormone. It's released when you're super stressed. Chronic release of it is a problem, though, right? In the short term, it's actually okay to have the cortisol release because it gets your body in a more active state, ready to, address whatever's causing the stress. But, with the depression and the anxiety, it's a prolonged release of cortisol, which will lead to deterioration of the body, right? So, deep breathing not only will increase your oxygen consumption, but you're also going to improve the activation of your vagus nerve. This is a nerve that connects, it's a cranial nerve that connects your brain to your heart. And when you do things like deep breathing, it improves its activation, and its improved activation will help calm down the heart, right? It's the nerve that calms things down, right? So deep breathing doesn't just affect you at the physiological level, it also affects you at the neurological level too, right? It's telling the nerves that go to the heart to tell the heart to just slow down, calm down, and that will help kind of decrease your cortisol as well. This is very important for the anxious types specifically, right? So the ones that have a lot of anxiety, and when they get into a panic attack, they get into that hyperventilation, and they're not getting enough oxygen, oddly enough, because they're not spending enough time taking that deep breath in and out. Okay. Deep breathing is also going to help improve your lung and your spine mobility, oddly enough, right? So when we have very shallow breaths, a very small portion of our lung is getting used. And so deep breathing is going to help open up the entire lung as well as open up your spine, right? Because when you take a deep breath in, I just actually heard my back crack over there, just taking that deep breath in, but it's getting your spine to move, even without you actively using the erectors of your spine. Okay. And then at the very perceptive level, we use deep breathing at the level of mindset, right? So deep breathing and meditation go hand in hand really well, because when you're in a meditative state, you want to improve your awareness about something. And when you have deep breathing happening, it's a really good thing to become aware of so that you can, prevent the fixation of those negative perceptions in your mind, like guilt, anxiety, pain, and regret. Okay. So let's talk into the two techniques that can help both address here, decrease rib excursion, as well as our altered fluid chemistry. Okay. So we're going to dive into thoracic rotation. Thoracic extension is also helpful, but we've already talked about thoracic extension when we talked about, our guy that was locked with shoulder flexion. We talked about how he could use thoracic extension. So I'm not going to dive into that again. I think you guys have a pretty good idea of what that is. Let's talk more about thoracic rotation, right? So in general, I've also kind of mentioned how we haven't really talked about how rotation is important, and people don't address rotation as much as they should. Everything's really guided in that, that sagittal plane. No one really talks about rotation. No one really exercises in rotation. So I think it's really important to touch upon that as well. When you do something like thoracic rotation, I usually assess an individual's thoracic rotation if they have back pain. It's always the case that someone's going to be restricted one way versus the other. And I know for myself, I have a very, very poor left rotation. So I spend way more time addressing my left rotation than my right. But for everyone, there's usually a restriction in rotation, and that's communicated to your rib cage as well as your thoracic spine, right? So we use something like this stretch over here called the open book stretch to help unlock a lot of these restrictions, right? So we begin in this position over here where you have an individual lying down their side, arms fully extended, knees bent at 90, close to the chest, right? So you should also be lying ideally with a pillow tucked underneath your head over there. I couldn't find an image where someone was actually using a pillow, but I prefer having the head supported because it will be rotating around as you do this movement. So it just provides a little more support to the head. So just keep that in mind, guys. So always have a pretty shallow pillow over here just to support the head a bit more. Now, this movement is initiated first by rotating that top arm away from the bottom arm, right? So you start over here, the bottom arm stays in place, and then you rotate that top arm. And with it, you're going to rotate the head. So you want to watch that top arm rotate away. So that head's actually fixated on that moving arm. Okay. And in doing so, you should feel a couple things happen. You should feel your mid back start to kind of open up a little bit, as well as a pec stretch. So the great thing about this one is not only are we opening up the thoracic spine, we're actually opening up the sternum and your pectoralis major at the same time. Okay. Now the bottom hand stays put. So you don't want that to lift up at all, right? So that's the second point over here. You want your bottom hand to just stay put to allow that rotation to happen. Okay. Now the third point over here is you want your knees to stay bent and close to the chest. The reason why we have that is that when that occurs, it actually locks your lumbar spine, right? So your lumbar spine is the spine that rotates the most apart from your neck. If you have that locked by bending your knees at 90 degrees, this will focus more of the attention on your upper spine, right? So having the knees bent in this position is very important, and make sure your knees don't lift off the floor when doing this exercise. So you want to make sure they're bent and locked in the floor. A lot of people will have their two knees kind of separate from each other. Don't let that happen. Make sure they're tucked in. If you have a hard time doing that, tuck like a small little roller or a ball in between the knees and have them contracted to each other so that you don't move them at all, okay? Now, the fourth point over here is that the goal is not to get your hand to touch the floor or to get as far down as possible. The goal is to get that shoulder blade to touch the floor, okay? Because it's the shoulder blade that's going to really move the thoracic spine, not as much as the hand, right? You can have really good pec major mobility and be able to touch the floor, but the scapula will still be lifted off the floor if you really wanted to, right? So guide the movement with your shoulder blade, not with your arm. Okay. And then the last point is that the breathing timing is important. So you want to inhale when you're at this position And then you want to exhale towards the end of the movement, which will help improve the amount of stretch that you get. Now, doing this for 15 reps each side, about 1 to 2 times a day is ideal. I like to do this early in the morning just to get things moving, because I know with myself, my upper back is super stiff in the morning time. So I got to just, before I do anything, I just do my rotations, get my reps in, and then I'm feeling great. I'm feeling already nice and loose. I'm not getting that tightness in my upper back. Okay. Any questions about this exercise, guys? And does anyone do this exercise already? Maybe a couple of you guys are already doing this. Okay. Yes, it's a very common yoga exercise. Yeah. And it's a very common yoga exercise, but I feel like we should do it more, right? And again, it just comes back to that point that we never address rotation as one of the cardinal movements of our exercise programs, right? So throwing it in a bit more might help improve that upper back mobility, right? Now, of course, there are caveats, right? So if you have a lot of pain in the upper back and this is causing more pain, it's probably not the right time to use this exercise. You might just need more soft tissue work and gentle range of motion exercises. But I mean, if this is not causing pain and you feel like a restriction, this is a great one to go to. And there are ways to modify the form to get a better stretch. So you can have your top leg come a little bit more forward than your left leg, and it just winds up the back a little bit more. So there are ways to kind of modify it, but generally speaking, the main point I was trying to make with this exercise is that it's a great way to kind of address that thoracic tightness that we get with that, poor depressed posture, right? How long should you hold it before the next rep? It really depends, right? So my suggestion, hold it for at least a second or two towards the end. And that way you can let that end of the exhalation kind of help provide that overpressure into more of a stretch. Um, I recommend everyone to kind of try today and see if one side feels a little bit tighter than the other, right? Like I said, for me, going to my left is a little bit tighter, but for everyone, it's a little different, right? It really depends on what you do. I find for me, I'm always just kind of locked in with left shoulder forward. And I've also had left knee problems. So I think both of those kind of led to that lack of left rotation I have, whereas rotating to my right is beautiful, right? But see if you guys have a difference, right? So when you do it, see if there's a range of motion difference, see if there's a difference in how it feels in your upper back. And if you do have that one side that's a little tighter, I would address it with more reps or more time spent holding each rep. All right, lastly, deep breathing. And I know a lot of you guys have already done a lot of this, might even be practicing it now. There are so many great types of techniques, each serving a slightly different purpose. For our purposes today, we're going to go over a very general, basic form of deep breathing, but really be picky about the form and why we use the form. All right, so I have this guy in a crook line position, and we have a few different numbers over here indicating the different positions I want to touch upon real quick. So the position is as follows, guys. Okay, so one, the head over here is relaxed. It should be facing forward. It should not be fully extended, nor should the chin be tucked too much. It should be a little bit in between to help prevent any kind of obstruction from your windpipe. Okay. This allows maximum flow of air while relaxing the neck muscles associated with stress, including our scalenes and our SCM. Okay. Number two, shoulder position. So the shoulders must be fixated down. Okay. We talked about how a lot of the time in that bad posture, our shoulders are elevated. Make sure they're fixated down. Don't keep them too hard fixated down. Just make sure they're not going up every time you take a deep breath. A lot of us are chest breathers, meaning we expand predominantly from our chest and we get a lot of elevation. So we see this happening, right? Every time we take a deep breath in, our chest just elevates, but it's a very inefficient way of breathing, right? Our neck muscles are actually the ones causing the movement, right? And so you're not getting as much oxygen, your neck is getting all flared up. And you could always spot a chest breather just based on watching what happens with the neck. You're going to see their SCMs just kind of like bulging and sticking out every time they take a deep breath. So um, keep the shoulders down in this position to help kind of down regulate that type of breathing. And this will also help prevent the use of the neck muscles while breathing. Okay. Number 3, hand position. This is also important. By placing both your hands on your lower abdomen, you're doing 2 things, right? You're giving your brain some tactile feedback about your stomach through the pressure and the heat being exerted on your stomach. And second, you're giving a target to breathe into. Okay. So the type of breathing that I'm talking about is more belly breathing or lateral costal breathing or diaphragmatic breathing, whatever you want to call it. This type of breathing is you want to kind of visualize that you're blowing a balloon into your stomach. Okay. This will help get the major muscle of your breathing activated. Do you guys know what muscle that is? What's our big breathing muscle? Can we see who could answer this the fastest? How about that? Let's see who has the fastest answer. What's our major breathing muscle, guys? Yep, diaphragm, diaphragm. And we got the correct spelling too. That's a hard one to spell. So it's definitely the diaphragm. It's the muscle that sits at the bottom of your lungs. And when we do a lot of the chest breathing, so when we're using our neck to breathe and we're getting the chest elevating, we don't use our diaphragm as much, guys, right? So breathing into your stomach, getting your stomach to fill like a balloon when you inhale and to deflate like a balloon when you exhale will get that diaphragm to get more activated, okay? It's not to say you can completely prevent your chest from elevating when you breathe, but you can minimize it, right? So when you get the diaphragm more involved in the breathing, you will increase the amount of air that you take in and put into your lungs, right? And we talked about why we need more air. We need more oxygen. We're not getting enough oxygen when we have that depressed posture, right? Okay, so that's hand position. Number 4, knee position. Having your knees bent puts your abdominals in a slackened position. So this makes it much easier to expand your stomach when you take those deep inhalations of air, right? So that's a pretty straightforward one. Number 5, foot position, making sure your feet are fully supported on the floor and having them on a surface where they don't slide is important. So just make sure your feet are not sliding. Knees and feet should be shoulder width apart while doing this as well. That's just going to be the optimal breathing position, right? So breath timing is important too. Inhalations can be anywhere from 3 to 5 seconds long and done through the nose if possible. And exhalations should be close to double the inhalation time. So if you're inhaling for 3 seconds, exhaling for anywhere from 5 to 6 seconds is ideal. And you want this to be as passively done as possible. So inhaling is a very active process. We got to use that diaphragm, contract the muscle. Exhalation is a very passive process. Elastically, our lungs are just going to they're just going to blow out air if you really let it. Okay. Think about the balloon example, right? You really have to like blow into a balloon to kind of inhale, like, to cause it to expand. But to deflate a balloon, you just have to let it go. And it's going to decrease in size. So think of your breathing pattern like that too. Make that inhalation through the nose really active. So breathing all the air into that balloon we're calling the stomach, and then exhalation out through your mouth. Blow through a straw hole if possible. That's going to create a lot of back pressure to keep the lungs open as long as possible. So as opposed to having the mouth open, blowing through that little tube created by your mouth is going to create that back pressure in the lungs to keep it nice and open, improving all that oxygen intake, right? Now you can do this for 10 reps at a time, multiple times a day. Again, this is good for my guys with anxiety who have, a lot of overactivity problems with their breathing. And so this is kind of a way we use to help calm them down and to get more oxygen to the lungs, which will help decrease cortisol levels, which will eventually help the depressed individual as well. Okay. So in summary, we can't just address something like a depressed posture with pharmacological interventions and cognitive behavioral therapy, right? We need to also introduce the intervention that will address our fibrous network, aka our myofascia, through things like corrective exercises, deep breathing, and movement and lifestyle management. Okay. Any questions about that, guys? Cool. So that's the end of the lecture for today. Yeah, my hope is to have the lecture slides available a couple days before every single week now. I'm really, really happy that the YouTube live feed worked really well today. So that's going to be available immediately after the lecture. As always, I'll post a link in the Facebook group. Again, see if you guys can try out these two techniques today. Give me feedback about what you thought. I know a lot of you guys are already doing a few of these techniques. Think about the little details that we talked about today. So for the thoracic rotation, find out if you do have a restriction going one way versus the other. And with the deep breathing, see if you haven't been using one of the techniques, see if you can add one of the details I added to kind of facilitate a better breathing pattern. And we'll go from there. So I'm here for questions for the next 10 minutes. But otherwise, if you guys don't have any questions, have an awesome week. Enjoy the weekend as well. We're going to repeat again Thursday next week at 9 a.m. We're going to be into February, so that's pretty cool. This month went by really quick. Don't know where it went. Yeah, I'm here if you guys have any questions. Sarah, you have a wonderful weekend as well. Deb, thanks so much for tuning in. You have an awesome week as well. My pleasure as always, Mujahid. Have an awesome week, okay? Penny, I hope you have an awesome week as well. Thanks for tuning in. See you guys all next week. My pleasure. Have a good one.